Are you getting ready to enroll in Medicare and considering a Medicare Advantage plan? It's a great option for many, but you still want to know your pros and cons before jumping in. Hi, my name is Sarah, and I'm here today with iHealthBrokers to discuss the advantages of Medicare Advantage. Medicare Advantage works in a unique way. It's similar to a Medicare supplement plan in that it addresses the gaps of original Medicare, but it has different benefits than a supplement plan. For example, most Medicare Advantage plans have prescription drug coverage. Now that's something that is not offered by Medicare supplement plans. You'd need Medicare Part D. Make sure to check out our video on Medicare Part D to learn more about that. A lot of Medicare Advantage plans also have additional benefits like hearing, dental, vision, or even gym memberships. But is Medicare Advantage right for you? Honestly, the answer really depends. I'm sorry, we can't give you a clear-cut answer via video. It depends on things like the doctors and hospitals that you wish to visit, your specific health needs, your financial concerns, and even the state that you live in, believe it or not. So because of this, we really do recommend that you work with a broker. Now, if you want to go it your own, you can certainly log on to medicare.gov, that's medicare.gov, and access the plan finder. There you'll find a myriad of different plans available. However, like I said, there are a myriad of plans available, meaning a lot. So because of that, you want to contact a broker who can help you weed through all the plans and find the best one for your needs at the best price. When you work with a broker, there's no additional cost. They just make things a little bit easier for you. If you'd like us to help, you can give us a call at 888-410-0344. We're licensed health brokers and we work in 50 states and with over 200 carriers. So pretty much no matter where you are, we can help. All right, let's get discussing Medicare Advantage. A common concern for people with regards to Medicare Advantage is, of course, am I eligible? And the short answer is yes. As of 2021, you cannot be denied Medicare Advantage. Prior to that, the only way that you could be denied was with end-stage renal disease. But like I said, as of 2021, that criteria is going away. The reason that some people get confused is because there is medical underwriting, or rather I should say there can be medical underwriting associated with Medicare supplement plans, but not Medicare Advantage. I want to bring this up for a very important reason. You really should do your research in advance to make sure that Medicare Advantage is right for you long term. Because if you start out with a Medicare Advantage plan and later down the line you want to switch to Medicare supplement, at that point there could be medical underwriting, meaning you could be denied. So if you develop some health concerns between now and then, you could be denied. So please make sure that Medicare Advantage is the plan for you long term, not just for right now. You can enroll for Medicare Advantage, also known as Medicare Part C, during your open enrollment period. That would be the 3 months before your 65th birthday, the month of your 65th birthday, and the 3 months after. This same time period applies if you're going to be receiving Medicare through disability. It would be on or after that 25th month that you're receiving disability. You may also be eligible for a special enrollment period. Let's say you're deferring Medicare because you're continuing to work past 65. In that case, you may be eligible for a special enrollment period. However, if that's the case, we'd recommend contacting a broker in advance because you want to make sure all your options stay open to you. Now, you always have the option to enroll during the annual enrollment period, or AEP. That happens every year at the same time, and that would be October 15th through December 7th, and then your coverage begins on January 1st. During this open enrollment period, you may switch your Medicare Advantage plan, sign up for your Medicare Advantage plan, or leave a Medicare Advantage plan. This same time period also applies to Medicare Part D. So just as an FYI, you can switch your Medicare Part D, you can sign up for Medicare Part D, or you can leave Medicare Part D all during that time period. All right, let's get down to the nitty-gritty with the plans of Medicare Advantage. Medicare Advantage will actually probably feel pretty familiar to you because generally speaking, it works as either HMOs or PPOs. You've probably had the opportunity to enroll in either an HMO or a PPO with your insurance in the past. Now I'm going to go over the bullet points with you, but remember, the benefits do vary widely from carrier to carrier, so it's really important to make sure you know what the requirements are with your carrier. Okay, with HMOs, you need to have a preferred physician. You will be required to have referrals for a specialist. Also, it's very important that you receive in-network care unless it's for an emergency or out-of-area urgent care or out-of-area dialysis. Because if you don't have a provider that's working in-network, you will be responsible for all of those charges. Not a good thing. Now with PPOs, there tend to be a little bit more flexibility. However, the out-of-pocket costs tend to be higher. With a PPO, you don't need to have a preferred physician, you don't need referrals for a specialist, and you can choose to see in-network doctors or out-of-network doctors. There will be some coverage either way, but you're going to have more coverage if you see an in-network doctor. Make sense? So, like I said, it's probably pretty familiar to you with regards to HMOs and PPOs, but it really does depend on your carrier. Because just because those are the general guidelines for HMOs, let's say, with your carrier, you might not need a referral to see a specialist. So, for this reason, we recommend working with a broker and certainly checking what the benefits are in advance before you go to see any doctor. Some last little tidbits about Medicare Advantage. If you do decide to enroll in Medicare Advantage, make sure that you present your Medicare Advantage card when you're receiving services, not your original Medicare card. If you do that, your claim is going to be denied, you're going to receive a bill, and you're going to have a headache. So make sure that you put away that red, white, and blue card, put it away someplace safe. That's what we advise our clients to do. That way, if you need it further down the line, you know where it is. Also, with Medicare Advantage, your benefits can vary from year to year. So if you signed up because you want vision coverage, it might not be available the next year. So talk about that with your broker in advance. And one more thing, with Medicare Advantage, there can be multiple copays for one single visit, and they can stack up. Now that's not to say that Medicare Advantage may not be the right plan for you. Like I said earlier, it really does depend on what your specific needs are, what your state is, what hospital you want to use, those types of things. So if you have any questions, please give us a call, 888-410-0344. We work for you, not the insurance company, and we do it at no charge. And should there be any issues down the line, should you accidentally present that Medicare original card instead of the Advantage and you have a headache, we'll deal with it for you. I hope today's video has been helpful and given you a little bit of insight about Medicare Advantage. Make sure to like the video and click subscribe so that way you can stay up to date on all things Medicare. If there's any other videos you'd like to see, leave us a note in the comments below or just say hi. We'd love to hear from you. Thanks and have a great day.